we're talking about actions that Health Canada is taking to remove our access to natural health products. And one of the initiatives is in the federal budget bill, they snuck in changes to increase penalties on natural, practitioners and companies that supply natural health products. And when I say increase, we were at $5,000 an offense before June 22nd, and they bumped that up to $5 million per day of an offense. So they basically own you. It's going to change my legal practice, because if somebody hires me now when Health Canada is going after them, I don't know that I want to take the file, because the risk is so high for them for not complying that basically, the government now owns you, much like in British Columbia, the provincial government owns the health practitioners now. And it was a pure on, sneaky move, because these powers and this fine structure and these powers that were just imposed on the natural health community, Health Canada first tried to get imposed on us in 2008. The bill then was Bill C-51. And that was the second largest citizen rebellion in my lifetime. And the government backed right down. So they knew that people didn't want this to happen. It's gone through 3 readings in the House of Commons and 3 readings in the Senate. And the Governor General has signed it into law on June 22nd. But your real question is how can it be that members of Parliament and members of the Senate would be passing a long budget bill without understanding everything that's in it, especially those parts that have nothing to do with the federal budget? So there's so many bills, before Parliament that, the MPs don't have the time and or the inclination to actually understand what they're voting on. And then you add into that basically they have to vote along party lines anyway. Maybe that's a disincentive, because why bother? What's happened is we're having a breakdown of the rule of law. So, like if I was talking to another lawyer, I would say, well, these penalties have moved us into the tyranny zone. And all tyranny means, look it up in a dictionary, it just means unfettered discretion. And so fines are meant to encourage the majority of people to comply with the law. So they're meant to sting but not destroy, so that most people will comply with the law. You always have the odd outliers that just won't regardless. But when you bring in a fine structure that is punitive, that will destroy people, then they can't even have a dialogue with the regulatory body, because we're in the tyranny zone here. It's just so over the top and so inappropriate. I've been involved, as a lawyer with the regulation of natural products. I'm working on year 30. And for my entire career, my first introduction, I was actually acting for Health Canada against the herbalists. But it's been clear to me for my whole career that Health Canada's intention has always been to regulate these the same as chemical drugs. Because when I was working for Health Canada, I believe the danger was allowing Canadians, consenting adults, to access a treatment that is not approved of by the government. I believe that was the danger. But after I prepared for that trial, I realized the danger was not allowing consenting adults to choose whatever treatment they wanted to, especially when the approved government treatments was a death sentence for them. A large number of Canadians are only alive because of natural health products, and a larger number manage really serious health conditions and only have quality of life because of natural health products that they, arrived at after all the approved treatments failed. But both in the United States and Canada, the regulatory bodies in, kind of mid-'80s into the 90s were aggressively trying to apply the chemical drug model on natural products and driving them off the market. And citizens rebelled. Well, the citizens in the U.S. rebelled first. And it was such a large rebellion that Congress actually was forced to look at it. They were forced to have a serious look. How should we regulate natural health products? Which included having a serious look at, are they really risky? The FDA is saying, the citizens need protection. And when Congress looked at it, it became a joke. And it's just a joke when the government says these products are risky and you need to be protected. So in the United States, they passed a law in 1994, the Dietary Supplement Health and Education, which deemed natural health products as foods. In the U.S., they're classed as foods. In Canada, they're classed as drugs. In the U.S., they're presumed by law to be safe. In Canada, they're presumed by law to be unsafe. You have to prove they're safe to get Health Canada's permission to sell them. This is a case where I've got a Health Canada inspector on the stand, and I'm trying to box her in so that, so I've got all these setup questions, and then when I finish them, she's going to have to say yes to the, where I'm going. And so these are all questions I'm expecting just yes answers to. And one of them was something like, as a Health Canada inspector, you're there to protect our health. And I'm expecting yes, and I don't get a yes, I get a no. Now I need a yes. So I keep circling around and try to get her to say yes. And finally, she shuts me down, she's under oath, and she truthfully explains to me that Health Canada, and then, by implication, Health Canada inspectors, is not, and so Health Canada is not there to protect our health. Health Canada is there to enforce the Food and Drug Act and regulations. And I challenge anyone to read the Food and Drug Act and drug regulations, and you show me where Health Canada is charged for protecting our health or acting in the public interest or getting good health outcomes. It's not there. Well, at the same time, they're going to impose the fees the chemical drug companies are charged. So chemical drug companies have to pay site licensing fees and product licensing fees and the like. And they're going to impose those on natural health product companies. So, right now, natural health products, if you're economically disadvantaged, you can't access them anyway. So but now that's going to be, just of a vengeance. They're going to become so expensive that people won't buy them, and that in itself will tank the industry. You are responsible for the state of our country, and you are responsible for changing it. If we just let this madness to continue, we're going to find ourselves in cages.